is we're always talking about the vessels in reference to the direction of flow within them. So arteries we referred to as the reference point, which was the heart. And veins, I like to talk about them from the distal region and then back to the heart. Okay? So the head, neck, and brain is going to drain down via the superior vena cava. And then these are your brachiocephalic veins that would drain back into that superior vena cava. These are your vertebral veins. And here is something different that does not have a corresponding artery name to it. It is the jugulars. So there's an internal jugular that runs or drains into these brachiocephalic veins and then drains back into the superior vena cava. So external jugular here, and then they combine to make the big jugular veins here. So there's the subclavian, same name. And here's something new that does not have a corresponding artery. It is called your cephalic veins. Do not confuse the word cephalic with anything to do with the head. The cephalic is part of your arm, and it's an extra one on the opposite side of the brachial artery. So there's still an axial artery, and instead of having a brachial artery, there is a basilic vein. So this is the cephalic vein, this is the basilic vein. So how to reference the basilic vein? It begins at that venous arch down at the carpals and joins the brachial vein here, becomes the axillary vein, then brachiocephalic, then superior vena cava. Okay? So it's kind of like you never got off of 141, but it changed about 5 names before you got to your destination, or Peachtree Road, whatever you want to think of. You know, you never got off the road, but it changed about 8 names before you got to your destination. That's pretty much what we're doing here. All right, so this one is super important because this is the one we draw blood out of during venipuncture, and this is the vein that gets punctured, called the median cubital vein. It's the nice one that you can kind of visualize on your own forearm. So there's that brachial vein here. Radial, going to the radial side, ulnar side. And the big chunk down on the lower extremity is the inferior vena cava. And everything else in the abdominal pelvic cavity is the corresponding organ's name with the vein attached to it. So we have common iliac veins, if we're talking about the blue, internal iliac veins, external iliac veins, femoral vein, and here's where we have an additional. It is the longest vein in the body, and we kind of talked about it in lecture already. So there's a few different places it could be labeled. And it is the great saphenous vein. And if I were to zoom out, I would see it all the way down to about the medial side of the leg, foot. This is the femoral vein, popliteal, anterior tibial. Then we got a posterior tibial as well, and dorsal pedis vein.